Hi everybody, Dr. Garcia here. I'm going to give you some instructions with regards to your upcoming resurfacing procedure. This is for those of you who are having either a chemical peel or a dermabrasion procedure. I'm going to talk to you about the first week and then the second week. The instructions change just a little bit, but let's go through those now. So we typically perform dermabrasion around the mouth. That's this area right here. And the dermabrasion procedure essentially removes the superficial part of the dermis. So your face will look like basically a road rash around your mouth for a few days after the procedure. Like any other healing wound, we want to keep that area as moist as possible. So the specific instructions with regards to the first night are pretty straightforward. We like that wound to be covered with something that's going to trap the moisture, and that's typically the coconut oil. I will sometimes ask patients to use a bio-occlusive dressing of some sort. That happens sometimes, but this is the coconut oil. It's a great organic product, and it helps retain moisture in the healing wound. So what we'll do is we'll put that on there right after surgery, and typically there's nothing to do for the patient that first night. The coconut oil and the face washings are going to start the next day. The product that we like to use for face washing is Cetaphil. Now Lori has the Cetaphil gel or the Cetaphil liquid here. You can also use the Cetaphil bar, which is preservative free. But essentially what you're going to be doing the first day and for that first entire week is washing your face with the Cetaphil 3 times a day. If we've only done the resurfacing around the mouth, 3 times a day. And the motion is with the balls of the finger. We want you to scrub the area all the way around. You want to make a good lather, and then you want to rinse that area off with clean water. After you do that, you tamp the area dry with a lint-free towel, a towel that has no fibers or lint, and then you apply the coconut oil. Again, put some on the ball of your fingers and just gently rub that in, okay? You're going to continue to do that for that first week 3 times a day, all right? It's very important to maintain that moisture by doing these cleanings with the Cetaphil soap and the coconut oil 3 times a day. When you come in for your 7-day appointment, your 1-week appointment, I will probably ask you to kind of go down in terms of the cleanings to maybe once a day. I may switch you to using coconut oil only as necessary if your healing process is going along really well. We vary that depending on the healing process. As far as chemical peels, I typically do them around the eyes, or we will do a full face. The instructions are exactly the same. We want to maintain that moisture. We want to make sure that you're washing your face 3 times a day with the Cetaphil soap, and then apply the coconut oil everywhere that we have done the peel, and we will describe all of this to you on the day after surgery. And like I said, the same thing on the second week after a chemical peel. We may decide that you are healing so well that we want to kind of downgrade you on the number of times that you are doing these cleanings. But basically, it's all about washing, removing some of the debris with the Cetaphil soap, and then using the coconut oil 3 times a day routinely, and then like I said, we will kind of go down on that the second week. I hope this helps you with your instructions for your resurfacing procedure.